Hey guys, Dr. Christy Ennis. Today's video is for you if you are full of sit. Haha, you heard me right. It's that bad three-letter word, S-I-T. Now, we all know from sitting that we tend to have bad posture kind of in that upper spine and in that neck and shoulders. But what most people don't pay attention to is that actually affects this posture in the low back. So lots of sitting increases this arch because hip flexors and low back muscles get tight and these bum muscles stop doing their job. So butt muscles are supposed to help, right, extend. If they can't do that, this low back goes, pick me, just like Shrek, to help take over that work. So the important things today are going to be to release and stretch the low back muscles and hip flexor muscles, strengthen those glutes and those abs too. Those also play a role. So we're going to start down on the ground. We want to start with those releases. So to get that low back, that quadratus muscle, I'll link a video for this too. I have a whole video on the quadratus, but you're going to stick that underneath your side where that muscle tends to be a little bit sore. And you're going to bring that leg in a little bit of a rotation. You're going to bend it up, and then you'll straighten it and rotate. And you can play around with how you're rotating that leg, but it should feel kind of uncomfortable. I hate to say that, but it's true. A little bit uncomfortable, and you're doing this until it feels a little bit better. Okay? From there, we're going to go on to the hip flexor release. So we want to start by getting a little blood flow going through those hip and quad muscles, because quad muscle, one of the quad muscles, also a hip muscle. So I'm going to pull out the Derma Edge, which I will also link for you guys, and we're going to do a little bit of just gliding over those muscles. You can do this right over clothes too, just to get blood flow going, because again, we've been sitting, right? And so we want to get that loosened up a little bit first. Once that starts to feel just a little bit better, or a little less bumpy, you're going to take the edge right up where that top of that hip is. So here's the top of my hip. I'm going to drop down about a hand width into that little muscle, off to the side just a touch, and then I'm going to add a little knee bend and straighten. So this is one of those that hurts so good kind of thing, right? And again, you want to do this until it feels a little bit better, so it's not a number of repetitions. Now that we've released those muscles, we want to follow that up with a stretch. So to stretch that low back out, my favorite way is kneeling on your knees, clearly. You're going to reach those arms out in front, and if I want to stretch the left side of my back, I'm going to bring my arms over to the right, bring the left hand on top of that right, and then actually scooch my buns off the left side of my heel, which will stretch the lats as well as that big quadratus muscle. Obviously, to do the other side, you would reverse that and do the opposite. All right, for the hip flexor, especially if you are somebody that sits a lot, we're going to use your office chair and make you stand. That's always a good thing too, right? So to stretch the left side out, I'm going to bring the right foot up on my chair. I'm actually going to do a tiny bit of a pelvic tuck here, and I'm going to come straight forward. So you want to make sure that you don't do this or you don't do this, right? No arching in the back, and it's just that little push of that hip forward. Now, to really get all those muscles that surround it, we're going to do a couple different things. One, I'm going to cross my arms, and I'm actually going to rotate to the right, pause for a couple seconds, come back, rotate to the left, and you can see which one, if any of those feels best for you, and you want to then hold whichever side feels better, unless, of course, it's directly in the middle. Try to have a steady chair, too. I think mine's a little uneven. The other one that also feels good with this is, again, in that little pelvic tilt, right, squeezing those glutes, is actually shifting that hip. So I'm just kind of taking my hand and help push it in a little bit. This gets even more of a stretch and actually gets into the joint a little bit, which, of course, can also get tight if the muscles are getting tight. So tends to feel pretty darn good. When you're doing this, about 10 to 15 repetitions. When you're holding that pose, roughly 30 seconds or so, okay? From there, we're going to get an actual strength and stretch all in one. Woohoo, more bang for your buck today. So I'm going to go into a split stance. I'm going to go, and you can always do this with weights if you want to make it more challenging, but we're going to do that little pelvic tuck again. Squeezing into those glutes. I'm going to bring my arms up as that front leg bends a little bit. From here, I'm going to straighten both legs out, bring my arms down, and now I'm shifting that left hip back. So it's really the right glute. So left hip flexor stretch, right glute work. So just alternating back and forth, again, for about 10 to 15 repetitions. Both knees relatively straight when I push back like that. If it bothers you to bring your arms up, keep them down. Nothing wrong with that. But again, you can just hold those dumbbells right by your side too and really work on engaging all of those muscles. All right, we're going to get down to the ground for the last ones. Ooh, that was pretty loud. We're going to start with the abdominals, and I will also link some other ab videos here too, especially on engaging those deeper abs. Those are the ones that tend to shut down. So you want to start by gently pulling that belly button in, having a happy back position. So that doesn't necessarily mean totally flat, right? If you're already starting in a really arched position, sometimes totally flattening your back feels uncomfortable. So go with whatever feels comfortable. If you can do a little pelvic tuck, great, but don't worry about totally pressing down super hard. So really making sure everything is nice and stable, we're going to start with just a little march. Seems easy, but to really keep these muscles engaged, it can be pretty darn challenging. So again, 10 reps on each side would be the goal to start. If this is too easy, you can make it a little bit harder by doing a little march, straighten that leg, lower, and then bring it back in. I almost feel like a horse kind of doing this one, but you get the idea. To make it even harder, as long as you can stabilize, if you bring both of those legs up, and then add, right, that little either knee straight or knee tap down. Those are great ways to start activating some of those lower ab muscles. To get those glutes a little bit more, we're going to go into my favorite version of the bridge, which is the frog bridge. Heels together, toes apart. Because the butt muscles also bring the legs apart, this helps get all of those muscles here. And you just want to think about go up. Try to get, again, another little pelvic tuck and a glute squeeze at the top if you can. To make this one a little bit more challenging, you can always put a band above the knees, and you're getting some extra resistance by pressing out there. To make it even harder, I'm going to turn my toes this way, lifting one leg up, and now I'm actually going to work on stabilizing in multiple directions on both sides, actually. Right, so if I bring that leg into hip abduction, this right one has to stabilize extra hard, but the left one has to work too. Double whammy here, right? Don't worry if this one is too much to start. It's a great way to progress, but you don't need to start here at all. Woo, buns are already sore. Awesome. So thank you so much for tuning in. If you like this video today, please click that thumbs up button and subscribe. Thank you so much for watching today. If you would like to support me as well as reduce some pain and get rid of the appearance of that cellulite, click the link below to order your own Derma Edge, a device that I created and patented when I was going through the middle of Lyme disease in a lot of pain and needed a way to work on my own body. So the shape of the Derma Edge allows you to get all body parts in a gentle way. We're getting that fluid moving in between the layers, which helps you move better, helps get rid of that pain, and decreases that bumpiness of the cellulite. So make sure to click the link below to order your own.